So many awesome questions about running this week. Runners who have a history of arthritis or runners who have some knee pain and they're concerned that their running is causing arthritis. So I wanted to jump on a quick video to dispel some of these myths, rumors, and issues. Look, the number one cause of arthritis or thinning cartilage in the knee is aging. So, those of us who are getting into our 40s, 50s, and 60s, depending on your genetics or history of a previous injury, are going to have some arthritis in the knee. Occasionally, an arthritic knee is going to get cranky. It can be like a 2-year-old. One minute it's fine, and the next minute it's going off and bothering us. That can manifest as some swelling, some achiness, and usually you have some discomfort perhaps in the first mile, first 20 minutes of the run, and more often after the run. So you drive to the run, you get back in the car. By the time you get home, the knee's a little stiff and achy, and perhaps the next morning, the knee's a little swollen and cranky. So what's going on? Is osteoarthritis caused by running? No, it's that simple. We have to get away from the mechanistic thinking that pounding on the knee causes cartilage damage. As a matter of fact, cartilage likes the cyclical loading of running. It nourishes the cartilage because cartilage doesn't have a blood supply. So all the nourishment that the cartilage needs is within your joint fluid. So running helps to force that joint fluid into the cartilage and helps to nourish it. If you have some arthritis, is running going to make it worse? No, they've studied this quite a lot. In runners who continue to run, there is no sign of accelerated progression. And look, like anything else, the dose matters. So we're talking about average runners. We're not talking about the elite 1% who are running 50, 60, 100 miles a week. That might cause some damage. We honestly don't really know. We don't study these folks a lot because there aren't many of them to study. So osteoarthritis is not going to be initiated or caused by running. It's not going to progress faster because you're running. As a matter of fact, if you keep running, you're going to keep your knees and joints longer. Why is that? Because it helps to incite or turn on repair mechanisms that are in the cartilage. Yes, these repair mechanisms falter, they don't work as well as we get older, but it's going to protect the remaining cartilage. I run with a lot of people with arthritis, some with even bone-on-bone arthritis, that awful phrase, yet they're still able to put their miles in and run a few miles a day. So if you have osteoarthritis of your knee and you've been concerned that you might make it worse, look, you're not going to. If you've been told to stop running because you have arthritis, but your brain is telling you that you can still run and you need to still run, then run. You're not causing harm because of the running. If at some point in time the pain becomes too significant and you just can't run, now you're going to have to think about cross training. Hope that helps. Bye.